Hello, I am Dr. Ted Hudspeth, and I would like to welcome you to our Telehealth in Practice series. This is part of our on-demand grouping of presentations, and it is on team troubleshooting in telehealth. We have a series of many live webinars teaching people how to employ the use of telemedicine in their practice. And we also have a series of on-demand webinars where we teach how you can employ the use of telemedicine in your practice easily and effectively. As a reminder, this webinar series is funded in part by the TxLaw Telehealth Resource Center. TxLaw is a HRSA-funded program at Texas Tech University designed to provide technical assistance and resources to new and existing telehealth programs in Louisiana and Texas. TxLaw is partnered with Well Ahead Louisiana to serve as the support representative for Louisiana providers. TxLaw is also part of the National Consortium of Telehealth Resource Centers. You can access their websites and resources from all of the TRCs across the country through the consortium website. Their website is telehealthresourcecenters.org. I'm Dr. Ted Hudspeth, as I said before, and you can look at my full review on who I am and where I've trained, etc. But we will get started on this presentation today. A problem is a chance for you to do your best. So think about that. You know, many times whenever you make a mistake, that is when you learn the most. And when you have problems to overcome in a telemedicine practice, really, it's a chance for you to have worked ahead of time to try and learn what those pitfalls may be and plan for how to make them better. And of course, when we make them better for our patients. And we also make it better for the providers to have a very efficient practice whenever they're doing telemedicine visits. So I'm going to go through an overview of the various things that I will cover today. We're going to talk about team competencies. We'll talk about communication and connection, and we'll divide that out into looking at how to work on telehealth app downloads, making accounts, and using e-pre-checks. We'll also talk about operating system updates, browser updates, and broadband connection problems. We'll discuss audio and video issues, quality of the visits, and also safety and privacy issues and fears. You know, in discussing all of this, the bottom line is that problems need to be rectified so that you can allow effective communication between the doctor, the nurse, and the patient. You know, all of a sudden, what usually is a two-way street with just you and the patient in a room, really, we have to have the nurse in this triumvirate here, in this triangle. I mean, we have to have good communication between all of the parts of this cycle, or what ends up happening is you either can't have the provider and the patient connect, or it's not an effective communication because the things that each party needs to be able to communicate and provide information breaks down. So I'm hopeful that I can go through some of the pitfalls that you may experience and teach you and your staff how to fix them. So we'll start off mostly with talking about team competencies. You know, you have to have a team that is ready and can be effective at employing all of these strategies. So there are some special things that should be thought of as far as a competency in your team member. And this is for your nursing staff or an MA staff, whoever's helping you get connected with the patient. These are the qualities that you need to look for and teach. So there was a study that was done, and they showed that most nurses are not trained or are insufficiently trained to use technology effectively. You know, this is a new thing, and not everyone is as technologically advanced as we would maybe like them to be. And the potential for telehealth fails to reach full utilization whenever these core competencies are not present in our staff. And a better understanding of nursing telehealth entrustable professional activities, that can be abbreviated NTEPAs, and the required competencies can contribute to the development of nursing telehealth education. So basically, they found that if you could, number one, understand what core competencies are needed, and if they aren't present, you teach those and give those competencies to the staff, then it will really help out in the overall efficiencies and effectiveness of your telemedicine program. So in this particular study, what they did, they discussed which NTEPAs are relevant for nurses and which competencies they needed to possess to execute all of these telemedicine functions effectively. So 51 experts selected items from a list of 52 competencies based on the literature and on a previous study that they actually had reviewed. And the panelists in this grouping could add competencies based on their experience in their own practice. And the threshold used for a consensus on any particular topic was set at 80%. So the results of this study showed that these were the most important things that were needed. Number one was coaching skills. Your staff needs to be able to coach others. They need the ability to combine the clinical experience that they have with their telehealth activities. They need good communication skills. They also need their clinical knowledge. They need to know where they can employ this telehealth and where it may fit based on their clinical knowledge. They need ethical awareness. There are some things that just should not be done ethically through a telemedicine program. And they need to have a supportive attitude. They need to be able to convey to people that they are supporting them, and they need to, be able to show that attitude to others. And each NTEPA required a specific set of competencies when they actually looked at each one of these areas. They needed at least 10, okay? And so they did go through and they identified all of those specific things that they needed for those requirements to be their best. And in looking at these, one was supporting patients in the use of technology itself. So when we talk about support, actually supporting them with being able to get their phone or their computer or their app to work. Secondly was training patients in the use of technology as a way to strengthen their social network. So what was found in this particular item is that when the nursing staff taught the patient that they could engage through their computer, their phone, etc., to others to support them, socially, that was a big benefit, and it helped patients do better. So that was not only teaching them or supporting them to connect to others through social media, but that there are portals and ways to connect with their medical staff also. And whenever you combine all of that together, the patients see the value in all of that, and then we'll spend the time to be able to learn how to use the technology effectively. Next was providing health promotion remotely. So your nursing staff needs to be able to promote healthy lifestyles, diet, exercise, etc. And sometimes that's through these social outreaches that they do in their routine communications with patients. Not just being a data dump to people, telling them their labs are good, but then supporting them in other ways socially actually showed a benefit in patients communicating via all of our portals and our electronic means. Next, analyzing and interpreting incoming data derived from automatic devices for self-measurement. So just like a nurse or MA looks at specific data of glucoses or blood pressures, et cetera, to make a clinical, triaging system, so to speak, and be able to send that on to providers in an effective or efficient way was shown to improve patients' use of the technology, because then they saw some benefit because they ended up seeing some activity from the providers in caring for them. And then providing psychosocial support. This goes back up to talking about, the social networking that is allowed through this means, that really helps people feel better about themselves, feel like they're doing good things, and contributing to their overall health management over time. Next, your staff's encouraging patient to undertake health promotion activities. I alluded to this earlier, that, encouraging people to use their diet, their exercise, be compliant on their medications, follow up with their lab needs, their health maintenance items over time. All of this can easily be done through our through an electronic means, but the staff needs to be cued into that and a part of that. And when they do it, it really does help with our overall utilization of our platforms. Next, instructing patients and family caregivers in self-care. So we extend here to include family members. There are many times that when I start talking about doing the portal or utilizing our app, reviewing labs, doing a telemedicine visit, if it's someone who really has a fear of doing any of this, or they don't have the technological know-how on how to use this, all of a sudden when I can say, would you mind if I include your family member who may be helping you with your care already? Could I get them to help? Well, all of a sudden that really opens up the door for us to be able to really form a grouping of the people who are most interested in that patient's care, including the patient. So I really like being able to do that. And that may be the son or the daughter helping the person get the app, get an account, and get online, and then utilize the information that we send through that effectively. A staff member's ability to assess a patient's capacity to use the telehealth is obviously very important. Your staff has to be able to check the temperature, so to speak, of their fear level or their competency level. And then they have to use all these other techniques to be able to teach the patient how they need or how they can get online. But it has to start with an evaluation of where is the patient at square one on being able to start engaging through this method. And then your staff's ability to coordinate care with the use of telehealth technology, whether that be through direct video conference, of course, audio conference. The telephone is our historical main thing that we've telephonically or remotely connected with people. And then, of course, the use of our apps for email or messaging through the portals to be able to coordinate their care. Getting them to go to their doctor visit or their appointment that we made for them with a specialist, and solidifying or closing that loop or gap of communication with people so that we can get them to use those services in an effective way. So that's another facet of that allows this to be a very successful program for you. Next is independent double check of high-risk medications. So that's not only your staff's ability to be able to check medications and reconcile medications, but actually a patient's ability to be taught how to do this when they're checking in is a big help, not only for accuracy of what the patient's actually taking in their regimen, but also for your documentation, and it reduces the risk of errors down the road, et cetera. It also is a huge time saver for your staff when they can self-check that medication list. And then, of course, guidance and peer consultation. A staff member's ability to guide another staff member on how to do that various item. And the flip side is being able to take constructive criticism in a way that's healthy for them to be able to correct or make some of their own actions better over time. So all of these were things that were found that if your staff member has all of these qualities, they are really going to be an awesome team member in being able to make you an effective provider in a telemedicine type practice. So the attitude to support self-management, empowerment was a big deal in all of this list. And then of course, a use of an ethically correct attitude during video conferencing were probably the two biggest standouts in all of these. And the future of our networks are going to be dependent upon our staff's ability to be able to learn these talents. So looking at specific team responsibilities, we really need to plan ahead to prevent connection difficulties in the first place. And that's really the purpose of me organizing all of this information here and you reviewing it with not only yourself, but this needs to go to your staff so they understand what's expected. And I've organized the PowerPoint in a way that there's some stepwise or steps that they can take to help patients at various connection points where they often have problems. We'll go through that in just a little bit. Also, recommend training staff to start 15 minutes prior to an appointment to get the patient logged on to the visit. During that time, they can reconcile medications, get vital signs if possible, etc. So that when you log in, you're logging in at the right appointed time and you have all of the right information presented to you, just like if the patient had been roomed at your office. And then, of course, training your staff in some basic troubleshooting techniques will help you have a smooth visit, allowing you to focus on your patient care. So let's talk about the communication and the connection. Communicating with the patient and connecting with them. That is often the biggest troubleshooting thing that we have to go through. It's just getting them into the visit to begin with, especially if it's their first time. So we'll go through a few things on telehealth apps, accounts, and the e-PreCheck. So starting off with the apps itself, there are many different programs out there. Many of them use a separate app that the patient is actually goes through to be able to interface with us. So when a staff member starts looking at this problem, if this is their main problem spot, then they'll ask to be put on the speakerphone. This allows the patient to, if they're using their phone, to be able to use the phone itself to be able to click the buttons, etc. So you tell them to get on the speakerphone and then ask them for the type of phone or computer that they have. And you may have to direct that patient to go to the App Store or website to be able to download the app. Now, I've included in here links to the Apple, Microsoft, and Google app stores that a patient can go to be able to download your specific platform's app. And then, of course, they type the name of the app to use and then click download. So, even patients may have a problem with even remembering what their password was for their app store. So this can be a big issue for some. Of course, some of them need to have an authorization code when they do get the app itself. Some people may have the app already, but have actually been deactivated because they have never used the app, even though they got it one time and they set up an account in the beginning, but have never used it. It may have been deactivated over time. So patients may need to have specific instructions on how to actually remove their account or reactivate the account, depending on the platform that they use. At our office, we use Epic. And if I see that a patient had an active account, sometimes I will, from my own desktop, go in and deactivate that person's account so that then a new code can be generated and texted to them. And when it's texted to them, then, once they've gotten the app, they can use that code and can actually re-enter their account. So, what we're talking about here, guys, when we first started doing telemedicine as a pilot in our office, this was at the end of 2018, I only had 1 or 2 visits a day. And, I basically bore the brunt of trying to work with specific patients to get into their visits. Well, all through 2019 and growing the practice in telemedicine, although all of us in our office had, visits, there weren't very many. So the nursing staff didn't really have a lot to do with all of this at first. But then when the pandemic hit in early 2020 and all of our visits converted into telemedicine visits, oh my gosh, this was a big problem because all patients were being put through this cycle. It wasn't just some specific patients that I thought would be great for telemedicine. It was everybody. And all of a sudden, I mean, I've joked around about this, but my nursing station started sounding like a tech startup out in California. I mean, all I was hearing my nurses talking to patients about was downloading apps, log in, get into your website. I mean, just all of that, the verbiage that I heard out of the nursing staff was definitely all computer related and very little with respect to medical related information. So obviously that's because we did a lot all at one time, but it really showed me how important it is for your staff to understand some of these steps for every single patient if we're going to build a very robust telemedicine practice where many of our patients can get on. So after the patient downloads the app itself, then they often have to create an online account. So they need to enter their activation code into the app. And this is what I was talking about. I could actually send them that code with my particular program. Some programs self-generates their own code whenever a patient starts to log in. They then would put in a username and password that they can remember. And many require them to complete the security questions like date of birth, social security number, etc. And they may even ask them to set up a series of questions with answers so that they can re-enter the app if they forget their password in the future. Of course, they all have to accept the terms and conditions to be able to move forward past that. So once they get this app downloaded, get their account set up with whatever program you're using, at that point, many of them have what's called an e-pre-check. This is for every visit. A patient has an opportunity to go in and basically check off things that are pertinent to that visit that day. For instance, they can reconcile their medications. They can put in various symptoms they may have by entering some questionnaire information, etc. So during that e-pre-check, it also, besides verifying their health information, it'll also allow them to verify their insurance and any allergies. And a very important deal is reconcile their medications, prompt us with what medicines they are or are not taking. The other thing that is legally very important and required if you're going to have a telemedicine practice is for them to sign a consent for you to treat them through this method. And we've talked about consents in a previous webinar that I've done, so make sure you look at those because there are some specific requirements that are needed. All right, now we're going to look at some of the pitfalls that can occur when patients have an old operating system. Many of the newer apps that companies use require an updated operating system. So your major operating systems out there are your Apple iOS operating systems, Windows, and of course, Chromebooks. Actually, there are links to all of these. So if you're going, I intended this part of the PowerPoint to be a reference guide for your staff to teach them what steps to go through, and they can tell the patient over the phone where to go to. So we don't need to really go into great detail on this, but basically you can instruct the patient where on their desktop to go to start looking for, like about this Mac. It tells them what version they have. And your staff may know exactly what version they need for the app to work. And if it's not the version that is needed, they may need to do a software update. Okay. And here, clicking on upgrade now will allow that to happen. This is the similar, these are the similar steps that can occur when you're going through a Windows operating system update. And of course, same thing for the Chromebooks, where you actually go to the area of the little gear icon and click on the settings in the systems tray and click on that gear icon to be able to bring up the Chromebook operating system update. Okay, so once you've made sure that the operating system is correct, sometimes there's a browser problem. You need browsers to be updated also for some programs. Our particular video program recently changed so that we can go through a simple browser, but the browser has to be an updated browser. So it's similar. You've got Apple, Windows, and Google with the Safari, Internet Explorer, or Edge, which is the newer version of the old Internet Explorer. It's called Microsoft Edge. And then, of course, the Chrome browser. And I have listings on here how to go through each one. Here's the Safari for the Apple products, Internet Explorer / Edge update for the Microsoft products, and then the Chrome update for the Google products. And on this particular section, we're going to talk about broadband connection troubleshooting. Now, I do have a fair number of rural patients, so broadband speed can be a big problem. With this, it can make a visit really not worth it, and you may have to convert a telemedicine patient into an in-office visit if you just cannot connect with them good enough. If they're looking at specific speeds, a patient needs a minimum of 1.5 megabits per second download and upload. Those are your minimums. Now, this still would not always be the best, especially if it's an intermittent connection. So obviously, the better connection that you have, obviously, the better video you're going to have. In looking at some of the obstacles that people have, most people are going to have a phone. And when I say most, I'm talking about some of the disparities of care that exist, especially in our rural areas. Many people of color do not have computers, and that creates a disparity in care. Many are actually in rural areas where they don't have broadband, et cetera, for a computer to connect. So again, that's another disparity of care. But in the studies, there's almost no disparity between races when it comes to having a phone. So the point of this is that if you can get people to focus on utilizing their phone, it is much better for you to be able to connect in most situations. I have a whole presentation in this series on disparities of care. And I truly feel that telemedicine is one way that we can bridge some of those disparities and shrink those disparities of care. So be sure to look at that presentation to learn more about the disparities that exist and ways that we can maybe mitigate those and get more care to everyone. So this broadband connection is a particular interest of mine, especially in Louisiana, because there's actually a program right now called the Bell program, in which our governor has instituted a goal of getting broadband to everyone in Louisiana. That's what Bell stands for, BEL, broadband for everyone in Louisiana. And I am prayerful that that will work and we will be able to get broadband everywhere, because it will allow for this issue to not be an issue moving forward once that occurs. So ways that you can actually get the patient to check their Wi-Fi speed or their connection speed is to have them go to www.speedtest.net, and they can check their speeds and then they can tell you. It's just a simple click of the button when they do this, and it self-tests and then they can tell you. Ways that you can get them to maybe connect better is to get them to move closer to their router, wherever that is in their home. And if they are strictly going through cellular data, they may need to go outside of the building if their reception is poor, especially if it's a 10 building, because it seems like that always impedes people's ability to connect. Again, I was alluding to cellular may be better than computers, especially in rural areas where probably cellular data is often better than the Wi-Fi data. And in addition, many people don't have a computer, but sometimes it is better on their computer than their cell phone. So sometimes you have to switch back and forth to see which one may help someone connect with you. Of course, if a person has an Ethernet connection to the router itself, if they can plug in with that little cord, it kind of looks like a telephone cord, but it's a computer cord that would plug into the back of their router and directly into their computer, that would be awesome, because that gets them off of Wi-Fi and a direct plug-in with their broadband connection. So that might be a benefit for some if they are using a computer. And I have had cases where, you know, I'm seeing the video, but the audio is not there for some reason. So I literally have had some folks stay on the video with me on the computer, and I've called their home phone and had them talk to me that way. So that's another thing to consider. If you're trying to avoid a pitfall and actually connect with the patient and get some care done, then that may be something that you have to do. Of course, you can always drop the video, which, you know, video usually has more data requirements than audio, and actually just call the patient. Now, if you do that, then you have to document that this was an audio only visit, and you know, put that in your documentation, and then you would have to bill accordingly as an audio only call. All right, so let's talk about audio and video connection problems. Sometimes I'll log in and I'm seeing the patient, but the audio is not working. And it's just because they have not authorized their audio to go through this particular program. So patients must authorize access to their microphones during their initialization, and the same thing with the video. There's often, as they're logging in, there's often a little button that says, do you authorize for the audio and video of your device to be used for this app? And so they need to click yes on that. Now, sometimes they've gotten into it and, you know, they may have messed with the buttons before you logged in and they turned it back off. So you may have to instruct them to touch the screen and then make sure that there's not a line through their little camera or their speaker. So you sometimes have to instruct them yourself on getting them to do that. I have had some problems where while they're waiting on me, someone calls them. Well, when that occurs, the telephone takes the microphone away from the app that was being used. And when they hang up on that and get back into my audio visit, into my virtual visit with me, the app doesn't know where to put the microphone and it doesn't link back. So sometimes I actually have a little sign that I'll hold up and they read on the screen, you know, log out and log back in. And when they go back and come back in, the app secures the microphone and then they can talk, and it's you know, we can go from there. So some additional recommendations here are to ensure that the patient is not on the phone on the same device. You know, when I talked to you earlier about actually calling the patient, you know, if they're on the video through the portal or in their app on their cell phone, you need to call them on their home phone. So kind of think about that. Now, if they're on their computer, then you could call them on their cell phone. So you just kind of have to think about those things. You need to remind the patients not to answer a call while in the visit. And that's, of course, even when they're waiting on the provider. So this would be a good thing to maybe have your nurses tell the patient before they're logging in to not answer a call, so that we don't have this switch off of the mic occur. In the app, they may need to click on the gear setting to ensure that the correct audio device is selected. So for instance, if they're on a computer, computers have an internal microphone, but some people have an additional microphone plugged in, or they may have an external webcam that has a microphone in it, and it may be pulling from one microphone or the other, and that could create a problem. So in that respect, they may have to go into their settings and select the correct microphone that they want to use. If a patient has a lot of apps open, that may actually suck some of their computer's ability to utilize the app and connect effectively. So they may have to hard close some of those apps that are running on the computer. And of course, they need to ensure that the microphone is not muted on any of the devices that they are using, or if they're using an external, that the mic is not actually turned off on the microphone itself. So you have to think about those things. As far as lighting and screen view, I've had patients who turn on, they get in their visit in the dark room. Well, I can't see them. Well, the purpose is being able to see your patient. So sometimes you have to ask them to turn on their lights. And of course, if we're examining certain body parts, like in their mouth, I may need to have their lighting positioned in a way to be able to see what I'm trying to see from a physical standpoint. Sometimes I have to get them to actually click on the screen of their app of their phone, turn that little camera around, and this is the little icon with the arrows on a camera, where they can turn it around, and then they can utilize that other camera to be able to see what's going on. I sometimes employ the use of someone else in the room with them, or a family member that's with them, to be able to position the camera while they're looking at a particular body part, etc. Sometimes I have to get them to position their camera in a certain way so their phone will stand upright, and then they can start pressing on different areas of their body to do self-exam, or be able to point exactly where it hurts on a particular body part, etc. So sometimes I have to get them to position their phone in a certain way that's stable so they're not holding it. Also, some people tend to just move the phone all over the place, and it makes you dizzy almost when you're trying to talk with and examine the patient. So sometimes I get them to position it in a stable place. All right, let's talk a little bit about quality troubleshooting. So your audio and video must be adequate, or you should convert this to an in-office visit. And this goes down to quality of care. The quality of your audio and video are critical for you to be able to make accurate diagnoses sometimes, all right? And if not, then you need to have the complete authority to convert it to an in-person visit. And you should do so and not feel bad about it. There are limitations to telemedicine, and we are the ones responsible for making a determination on what we're comfortable with or not. Of course, quality in my mind definitely includes medication reconciliation. Getting a quality list of medications can start with the patient. It can go through the nurse to make sure that that is tweaked and appropriate. And ultimately, it is our responsibility to go through that list and make sure that the patient is on what is on our charting system so that we can make appropriate decisions. And the last part of the quality troubleshooting is vitals acquisition. First of all, for many of our quality programs and our payment systems involve the collection of vital signs and making sure, especially blood pressures, are accurate and are collected to begin with. So I really feel like our staff needs to be involved in this to cue the patient into getting that data to begin with, if they have access to a blood pressure cuff, to be able to check their own vitals, and then getting that information into the chart so that it can be recalled later and included in all of our health metrics for our patient population. All right, now we're going to talk about safety and privacy. As far as safety, we have to ask the patient sometimes not to engage in certain activities during the visit. The big one is driving. I feel this is a big risk. Many times I get into a visit with a patient and they're driving down the road. I just don't feel that that's a safe thing to do. And heaven forbid, I would feel terrible if during a visit, a patient actually had a wreck or had something happen because their attention was diverted from the road. So it is our responsibility to tell a person, you need to stop or we're just not going to be able to do this type of visit. And the other thing, I've had patients log in from lots of different places. I've had them log in during their hair appointments or their facials. I've had people running an instrumentation board at a chemical plant. I mean, many different places that people have logged in. And I just want to make sure that we are safe in delivering the care that we're giving, and location and activities that they may be doing and not think twice about could affect that for us and our patients. Of course, for emergencies, we need to know how to connect with emergency services in the area where we're providing care. Most of us are caring for our own patients. And of course, we know all of those types of things. But in today's world, you may start caring for patients who are very remote from you. And if you are in that position, then you need to be adept at trying to figure out how to get a person an emergency plan should that arise during your visit. And of course, always having next of kin information available is a big help to be able to help you know what to do next and who you can get to support the transport of a patient or connection to emergency services should that be needed. As far as privacy, this is another one that I see a lot of. People will log on at work, around other people, not even thinking that they might want to be talking about some sensitive information. So if I suspect that a person is anywhere besides their home, I will ask up front, are you in a private area? And, especially if you know that some sensitive things may be discussed, you need to upfront make sure that they are in a private area. Of course, it goes without question that you always need to be in a private area and should not be conducting telemedicine visits out in the open where other people could overhear your conversation with a patient, because that would be a HIPAA violation and that would be a really big deal. I have even used with some folks, I have ahead of time when they say, I'm okay now, but things may change. So we ahead of time agree on a keyword or a sign that we will give to each other should privacy concerns on either part of us arise. So for instance, say a person is in a place that they're private and they worry about someone walking in the room. Well, you can't see on the other side of their camera. They can. And so, but they may not want to alert you to say, oh, someone just walked in the room and I can't talk to you anymore. They may have a special word or a sign that they give you visually over the visit that you then know, oh, we need to quit this conversation or not resume anything more until we are in a new private area. So just think about that. Of course, HIPAA compliance, we mentioned this, you not only need to make sure that you are being compliant, but that you document all of that for the EMR. And now I'm going to talk about troubleshooting fear, because in starting the implementation of a telemedicine program, fear is really your biggest hindrance. You will have fear from the staff. You are going to be fearful. And of course, your patients have fear. And there are various fears that they have. And just about every fear can be overcome with empathic communication. I'm going to plug one of our other lectures or presentations. I did a complete presentation on effective communication, especially with respect to telemedicine. Effective communication is key because you no longer have the additional help of physical touch and things like that to help you in your visit. Communication becomes paramount. And when you can empathically do that, then people not only know that you know them, but they know that you care. So I encourage you to watch that video also, because I think it provides you with a lot of good information. So when patients have a fear of technology incompetence, and that's a lot of people, they really, will express that very openly. Your team's ability to express the plan to teach them is very helpful. Just your staff saying, look, I know lots of people that didn't know how to do that, but I will teach you just like I've taught all of them how to get online, and I'll help you along. That will help a lot of people say, okay, I'll try. Okay. The second fear is failing to complete the visit. Some people fear that they will not be able to get to the end of the visit. So it's, kind of a waste of your time or their time. So having your staff tell them that they are committed to following them at each point until they get the visit completed. Again, that's empathically expressing to them that they're going to help them. Next, people may have safety or patient data concerns. Many are fearful that if they're online, then everyone's going to know all of their information. Well, just conveying to them that we are forced to uphold the same HIPAA standards that we do in our own in-person practice, that we adhere to those same standards, and we protect their data just the same. When you express that to people, it usually will overcome those fears. And then, of course, patients have a worry that the problem that they have just can't be cared for through a telemedicine visit. Your staff's ability to share stories of similar patients being successfully cared for will help them say, okay, well, if others have been cared for, maybe I can too, and I'll give it a try. So a few additional troubleshooting tips are, it's kind of like, kicking the tire. Sometimes you just restart the app or the computer or the device, it'll all be taken care of. Okay, so if all else fails, turn it off and turn it back on. That often will help the whole error that's occurring. You make sure that the device is plugged in and well charged. Check that the internet connection is working and is strong enough to work with a telehealth platform. So they can, if they're on a phone, look at the number of service bars. Of course, I showed you how online on a computer, you can go online and actually check your the download speeds. Close all other applications. Some equipment really doesn't have the RAM needed to be able to have many things open and doing multiple things at one time, especially video, which is often intensive on it. And of course, updating your internet browsers and operating systems if need be. And if all else fails, they can try to connect with a different device. So for instance, if they were on their computer, ask them to try it on their phone, and vice versa, to see if that may help. So I'll end with a quote. The most important things in life are the connections you make with others. That is so true with telemedicine. It's not, in this day and time, it's not really how you connect, it's just connecting. And I truly feel that telemedicine, both in synchronous and asynchronous forms, will allow us a better opportunity to connect with others wherever they are, whenever they need us, and how they need us. And that holds true in all of these presentations that I've given. These are all tidbits on how you can get to connect with others. And to me, that is truly the most important way to be an effective caregiver to the people who entrust their care to you. So moving forward, We have lots of resources that I have collected and placed at the end of all of our PowerPoint presentations. And you can always connect with the Well Ahead Louisiana folks at wellahead@la.gov. And you can find all of these presentations along with the videos and PowerPoints at www.wellaheadla.com/telehealth. And you can always connect with me, Ted Hudspeth, at gmail.com. I want to thank you for joining us. Make sure you look for all of the other presentations, and I wish you the best in trying to build your own telehealth and telemedicine program to care for others. Thank you.